Welcome back guys. Now let's continue with the respiratory zone. Already we have discussed about the conducting zone, now respiratory zone. So take the heading respiratory zone, from which generation to which generation? From generation number 17 to 23, right? Now what is the lining epithelium? In the respiratory zone, the lining epithelium is simple squamous epithelium. Okay, simple squamous. Why it is simple squamous? Because for the exchange of gases, see, for the exchange of gases in the alveoli, you need to have a very thin epithelium. So that's why the lining epithelium is called as the lining epithelium is a simple squamous epithelium. Okay, and there is exchange of gases. You already know it. Okay, there is exchange of gases. Now these lining cells, they are called as what? Pneumocytes. The lining cells, these lining epithelial cells are called as pneumocytes. Try to understand. See, here I am showing you alveolus, one alveolus, which is a part of respiratory zone. Now this alveolus is lined by this simple squamous epithelium. Look at here. So these are the simple squamous epithelial cells. So this simple squamous epithelium. Okay. Okay, let me show you. So these are all the simple squamous epithelial cells. Now these epithelial cells which I am lining here, these epithelial cells, they are called as what? Pneumocytes. They are all called as pneumocytes. And now tell me, how many types of pneumocytes can you see here? There are two types of pneumocytes. See, these are all red color pneumocytes. They are called as a type 1 pneumocyte. And there is also this orange color pneumocyte. This is the type 2 pneumocyte. So now tell me, how many types of pneumocytes are there? The lining cells are called as the pneumocytes, and these pneumocytes are of two types, type 1 pneumocyte and type 2 pneumocyte. Now, which pneumocytes helps in gases exchange? See, it's the type 1 pneumocytes mainly helps in the gases exchange. Okay. Now, what about the type 2 pneumocytes? Type 2 pneumocytes are the stem cells. Whenever there is any damage to this epithelium, okay, whenever there is damage to the type 1 pneumocytes, the type 2 pneumocytes will replace them. Okay. So, right, type 1 pneumocytes, what they are doing? Type 1 pneumocytes, right, they are helping in gases exchange. They helps in gases exchange. Now what about the type 2 pneumocytes? The type 2 pneumocytes, they produce surfactant. Okay, they produce a surfactant, and also the type 2 pneumocytes are the stem cells. Now students will start to have a doubt, sir, what exactly is this surfactant? We know about the stem cells. Now what exactly is this surfactant? Very important point for your FMG exams and NEET-PG exams. Surfactant, what is this? Look, this type 2 pneumocyte, now I am telling you, see, this type 2 pneumocyte, it is forming a layer. So this layer which I am showing here, these dots, this is called as a surfactant. Type 2 pneumocytes produce surfactant. What is the importance of the surfactant? Let me tell you. So let's draw a small diagram. Let's say again here, this is the alveolus. Okay, here is the alveolus. Now in the alveolus, what is there? There is a thin film of water. Let's say here there is a thin film of water. Every alveolus, in every alveolus, there is a thin film of water. Some water molecules are there. Okay, not too much, not pulmonary edema, I am not talking about edema. There is a thin film of water which helps in the gaseous diffusion. So water is there, okay. And also air is going to the alveolus. Everyone knows who goes here, air. Air is there, and bottom here, water is there. Now wherever, try to understand. According to the physics, now we are going to the physics. Wherever the air molecules meet with the water molecules, air meeting with the water molecules, in this junctional point, there develops a very bad force called as surface tension. Wherever the junction, wherever the air molecules meet with the water molecules, there develop a collapsing force called as surface tension. So surface tension is what kind of force? It's a collapsing force. Collapsing force means it's trying to collapse the alveolus. Always tries to collapse the lungs or collapse the alveolus. Okay, but my question to you, our alveolus, are they getting collapsed? Our lungs, are they getting collapsed? No. Okay, so there is a protector. Who is that protector? See, in between these air molecules and water molecules, see, someone is coming and sitting. Okay, there is this thin film, this orange color one. What it is doing? It is actually floating on the water. Okay, it's actually forming a film. It is actually floating on the water. Okay, so what is this orange color thing which is actually floating on the water? It is separating, see, it is separating the air molecules from the water molecules. Now tell me, do you think the air molecules can meet with the water molecules? Air molecules, can they meet with the water molecules? No. So now whenever the air molecule is not meeting with the water molecule, what will happen to the surface tension? Decreases. What happened to the collapsing force in our lung? Decreases. So in our lung there are millions and millions of alveolus. So in this millions and millions of alveolus, okay, they can develop a lot of surface tension. Actually, that can cause the lung collapse. But our lungs are not getting collapsed because of this orange color protector molecule. And who is that molecule called as? This orange color molecule. This is nothing but our surfactant. Okay, here is our surfactant. So now tell me, surfactant is good or bad? It is good, sir. It is actually forming a film, separating the water from air, decreasing what? Surfactant decreases surface tension. Surfactant prevents the lung collapse. Surfactant is floating on the water. So who floats on the water? Oil. So surfactant is nothing but a lipid. It actually floats on the water, forming a film. Okay. So now write surfactant. 90% of our surfactant is actually lipid. Surfactant, 90% of our surfactant is lipid. So what is the name of this lipid, guys? There are some major lipids and minor lipids. The major lipids are called as lecithin and phosphatidylglycerol. These are the major lipids, two major lipids. These are phospholipids actually. Lecithin and phosphatidylglycerol. Lecithin is very, very important for your exams. Okay, very, very important for your exams. Lecithin. Lecithin is also called as dipalmitoyl phosphatidylcholine. Dipalmitoyl phosphatidylcholine. Okay, remember DPPC. Lecithin also called as the dipalmitoyl phosphatidylcholine. At least remember phosphatidylcholine. This is a major lipid. And what is the second major lipid? The second major lipid is phosphatidylglycerol. Okay, these are the two major lipids. Then what is a minor lipid? If someone asks you, there is also a minor lipid, minor phospholipid called as sphingomyelin. Okay, sphingomyelin. So there are certain major lipids and minor lipids. Our surfactant is a lipid, 90% lipid, 10% proteins. So always remember surfactant is a lipoprotein, 90% lipids, 10% proteins. And the surfactant proteins are called as A, B, C, D. Surfactant protein A, B, C, D. Okay. Next, let's see other important points about the surfactant. We all know surfactant is produced by type 2 pneumocytes. Okay. From when onwards? From somewhere around 20 weeks of period of gestation. From 20 weeks of the period of gestation itself, the lungs will start to produce the surfactant. In the fetal lungs itself, from 20 weeks of period of gestation itself, surfactant production started. And maximum surfactant production reaches somewhere by 34 weeks of period of gestation. You anyway know it. Fetal lung maturity, lungs will mature by 34 weeks of period of gestation, where you have enough amount of surfactant. Okay. So now, surfactant, it is produced from type 2 pneumocytes from 20 weeks of period of gestation. But surfactant, where it is stored? It is stored in some special vesicles called as lamellar bodies. So surfactant is stored in lamellar bodies. Okay, stored in lamellar bodies. That's the MCQ. Next up, what is the function of the surfactant? Have I already taught you? Surfactant decreases the surface tension. Surfactant decreases surface tension. What kind of force is surface tension? Surface tension is a very bad force, collapsing force, because of the air-water interference. Wherever air molecules meet with the water molecules, there in that junction develops a bad force called as surface tension. Next up, assessment of fetal lung maturity. You want to know whether the fetal lungs are matured or not. Okay, you want to know whether the fetal lungs are matured or not. We all know that fetal lung maturity happens by somewhere around 34 weeks of period of gestation, where enough surfactant levels reaches. So, if you want to know whether the fetal lungs have enough amount of surfactant or not, what you have to do? There are certain tests. First thing that you have to do is you have to collect the amniotic fluid from the mother. That is amniocentesis. Amniocentesis. Why amniocentesis you have to do? You know, amniocentesis means the collection of the amniotic fluid from the mother. Why? See, this amniotic fluid, it will go into the fetal lungs, it comes out of the fetal lungs. During embryonic life, okay, the amniotic fluid is going into the fetal lungs, coming out, into the fetal lungs, coming out. So if there is surfactant in the fetal lungs, the same surfactant will also show up in the amniotic fluid. Okay, so first what you have to do, you have to aspirate, you have to collect this amniotic fluid. Now in this amniotic fluid, what you have to check for? You have to check for the levels of the lecithin and sphingomyelin. Okay, you have to check for the levels of lecithin and sphingomyelin. That's a major lipid versus minor lipid. So if the ratio is coming greater than 2, the ratio is greater than 2, it indicates fetal lung maturity. Yes, fetal lungs are matured. So lecithin sphingomyelin ratio greater than 2 indicates fetal lung maturity. Next, any other tests are there? Yes, there is a test called the shake test. Now you collect the amniotic fluid and shake it. If bubbles are forming, means fetal lungs are matured. Why bubbles are forming? Because now this amniotic fluid contains surfactant. Surfactant is oil. Okay, oil is nothing but soap. So when you shake it, if bubbles are forming, means The amniotic fluid contains surfactant. Okay, because surfactant is nothing but the oil. When you shake water which is mixed with oil, it forms bubbles. So shake test or bubble test, also called as a Clement test. Okay, this is a bedside test, guys. Okay, so this bubble test can also tell you the fetal lung maturity, but it is not confirmatory. Okay, next, lamellar body count. Collect the amniotic fluid, and in the amniotic fluid, count the number of lamellar bodies. Okay, because what are lamellar bodies? I have told you, lamellar bodies are the ones which stores the surfactant. If you have good amount of these lamellar bodies, okay, if you have good amount of lamellar bodies, it indicates the fetal lung maturity. But these are not that best test. Okay, all these tests, yes, you can do. They are not confirmatory, they are not gold standard. But the gold standard test for the fetal lung assessment, okay, fetal lung maturity assessment is check for, okay, the gold standard is check for the presence of phosphatidylglycerol in the amniotic fluid. Okay, phosphatidylglycerol in the amniotic fluid. See, once if you see the phosphatidylglycerol in the amniotic fluid, it means the fetal lungs are mature. Okay, surfactant production has happened in the fetal lungs. See, what exactly is this phosphatidylglycerol? Don't forget, the phosphatidylglycerol is one of the major lipids, and it's only present in the amniotic fluid. Okay, it's not going to show up in the any other places. So once if you see this phosphatidylglycerol in the amniotic fluid, it indicates fetal lungs matured. Bas. Okay, so in your exam, how the question may show up in your exam? All of the following are the tests for fetal lung maturity except. So you should know lecithin sphingomyelin ratio, Clement test, bubble test, shake test. Okay, lamellar body count, the presence of phosphatidylglycerol in the amniotic fluid, you have to know them. Next, who stimulates the production of surfactant? Who inhibits the production of surfactant? Okay, who stimulates the production of surfactant and who stops the surfactant production? Say, stimulated by surfactant production in the fetal lungs is stimulated by glucocorticoids or steroids. Okay, glucocorticoids or steroids and thyroid hormones. These are actually good things. So the steroids and thyroid hormones, what they will do? They will increase the surfactant. Okay, they will increase the surfactant production in the fetal lungs, which is actually good for us. Okay, and who inhibit the surfactant production? A hormone called as insulin. Insulin is bad for the fetal lungs. It is very bad for the fetal lungs because this insulin, what it is doing? See, it is inhibiting the surfactant production. So insulin decreases the surfactant. It is very bad, decreasing the surfactant. So why you should know this, how it is important for your exams. Let's say there is a female. Look at here, guys, there is a female who is right now pregnant. Okay, who is a pregnant. Okay, there is a pregnant lady. Okay, now during her pregnancy, here is a baby, guys. Okay, here is a mother. Now during her pregnancy, what happened? She developed a complication. See, now she is little worried. She developed a complication. What is this complication she developed? She developed gestational diabetes mellitus. During pregnancy, she developed GDM, gestational diabetes mellitus. You all know certain females will develop diabetes during the pregnancy. Some will develop hyperthyroidism. Some will develop the preeclampsia, eclampsia, seizures. Okay, some becomes hypertensive during the pregnancy. Now our female, let's say our female, she developed, okay, gestational diabetes mellitus. So whenever she is having gestational diabetes mellitus, okay, what happened to her blood glucose levels? Tell me. There is going to be insulin resistance during gestational diabetes mellitus. She is going to develop the insulin resistance, so her blood glucose levels are going to be more. We all know during diabetes there is more blood glucose in the female. Now where do you think this glucose will go? Now this glucose is diverted for the development of the baby. Now more glucose. Now the problem here is there is more glucose that is getting diverted to the baby. More and more glucose is going for the baby. Now tell me, whenever the baby is taking up lots and lots of glucose, now the baby's pancreas is going to produce more insulin. Now baby is going to produce more insulin. Okay. Now tell me what this insulin will do. Whenever you are having more insulin in your body, insulin decreases surfactant. Okay, insulin decreases the surfactant production in the lungs. Now this baby is going to have less amount of surfactant in the fetal lungs. So less amount of surfactant means fetal lungs are not properly matured. So whenever this baby is delivered, do you think the baby can breathe normally? No, not enough surfactant is there. There is going to be more collapsing forces, more surface tension forces. That's going to cause respiratory distress, alveolar collapse. So without the surfactant, the baby cannot breathe normally. So that's going to cause neonatal respiratory distress syndrome. Okay, neonatal respiratory distress syndrome. Also, in short form, you can call it as NRDS, neonatal respiratory distress syndrome. It is due to deficiency of what? It is due to deficiency of surfactant. It is due to which hormone? Insulin. It is due to insulin. Now, the baby's pancreas is going to produce more insulin, more insulin, more insulin means problem, all problems to the lungs. So, right here, tell me this respiratory distress syndrome or the neonatal respiratory distress syndrome, also called as what? Also called as hyaline membrane disease. What is the major cause? I have told you the major cause is the deficiency of what? Deficiency of surfactant. Surfactant is not there. And what is the hormone responsible for this? The hormone responsible for the neonatal respiratory distress syndrome is insulin. Never forget. Now, which babies will develop this NRDS or respiratory distress syndrome is seen in premature infants. The babies who born, let's say, at 30 weeks of period of gestation. Okay, the babies who are taking birth at 30 weeks of period of gestation. Now tell me, by 30 weeks enough amount of surfactant is produced? No, enough amount of surfactant is not there. So when enough amount of surfactant is not there, the fetal lungs will undergo collapse. That can lead to NRDS after the birth. Or mothers who are suffering with, the mother who is suffering with gestational diabetes mellitus. The mother who is suffering with the gestational diabetes mellitus can give birth to a baby who will suffer with neonatal respiratory distress syndrome, because mother is having diabetes, more glucose will go to the baby, baby will produce more insulin, insulin decreases the surfactant production. So the mother suffering with the GDM, not the baby suffering with the GDM. The mother suffering with the gestational diabetes mellitus will give birth to baby who will suffer with the hyaline membrane disease, also called as respiratory distress syndrome. So with this successfully what we have completed? We have also completed about the surfactant. We have seen important points about the respiratory zone, and also we have seen the important points about the surfactant. Surfactant is very, very important for your exam. Okay. So with this, the topic completed. In the next video, we will be discussing about mechanics of breathing. Hope the video is helpful. Thank you.